the priorities that I bring to this race are really based on the priorities that wake people up in the middle of the night, that cause them to be concerned about how they're going to get through, how they're going to make it all work. And one of the biggest issues that wakes people up in the middle of the night, it is a worry, it weighs on them, is healthcare. And within the subject of healthcare, women's healthcare is a very big issue, and it has been a priority in my life since I was born, being, the daughter of a mother who dedicated her life to women's health. And so I brought it up on the debate stage because it is something that I have always thought about, and that being the sixth debate in the presidential cycle and no meaningful discussion about women's access to reproductive health, much less what we're doing around issues like breast cancer. I felt the need to point out that it is a big issue and should be the subject of serious discussion when we are talking about who will be the next president of the United States. Women are, I think, now the majority of the American population. And women's health issues are very specific when we're talking about access to reproductive health care. It's not only about choice, it's also about issues like breast cancer. You heard the story about, a woman who would have to travel 3 hours to get the care she needs. One, because of the lack of resources that we are putting into making sure that women don't have to have special coverage with their insurance companies to be able to get the coverage for the health care they need within the community they live, but also because we don't have enough facilities that are available to women. I mean, this is an extraordinary place. What's going on here in Dubuque with this center is extraordinary, and I knew about it, I've heard about it, and so I wanted to come and see it for myself. But these are the big issues. The big issue of what is happening in terms of women's access to the health care they need in connection with breast cancer in Dubuque, Iowa, is a big issue for me.
Okay. And, to that, carrying on, what's the move from the federal level that can have impacts directly in places like Dubuque?
Well, part of it is what we need to do around reform of the healthcare system, because as you heard, it is still an issue, which is copays and deductibles. Still an issue. My plan for healthcare and reform of the healthcare system in America is that I have a Medicare for All plan, and it is different from my colleagues on the stage. Mine will not increase middle-class taxes, but it will cover everyone. It'll bring costs down. It'll get rid of copays and deductibles. And very significantly, another point of distinction is that I will not take private plans away from people. If people want to have a private plan, they can under my Medicare for All system, or they can have a public plan. They get the option. Because I heard too many people say, don't take away our option of having a private plan. But without any question, my plan would address what we heard here, which is that one of the barriers to women receiving the health care they need in connection with breast cancer is copays. And my plan will get rid of them. And so, part of the way that I always approach issues is, how does this affect real people every day? So when I created a plan to eliminate copays, it is with those women in mind that we just heard about here. No one in our country should be denied health care because they can't afford it. The irony of my life and my personal experience on this is that my mother, who dedicated herself to curing cancer, died of cancer. Thankfully, my mother had Medicare, and we had the ability to make sure that she had coverage. But that is not the case for a lot of people in our country. And it is inhumane, from my perspective, that anyone would not receive the health care they need because they cannot afford it.
What about this city? What about this kind of city? you know, is important, not only to winning the election, but to how you plan to govern.
I mean, a place like Dubuque, I mean, it being the oldest, you know, in Iowa, it represents obviously the history of the state. There are long-standing and great traditions and community leaders here. And it also, given the diversity within Dubuque and the challenges that Dubuque faces, is really a measure of the challenges that our country faces. And so I think about being here, listening as much as I talk, and as giving me reinforcement about what are the challenges that we face, what are the issues that are fundamentally an issue about justice and injustice, such as healthcare justice, such as reproductive rights, just in the context of justice. And being here helps me fight against those injustices at a national level.